Welcome to our October 15th session of our 2020 Interfaith Symposium. Today's session is titled Strategies to Increase Protective Factors and Decrease Risk Factors During COVID-19, being presented by our very own Joel Torres, manager of ADAPT Coalition of Family Connections. My name is Jessica Delgado. I am one of the coordinators at Family Connections ADAPT Coalition. I also have with me Gwinnera Curry, our faithful Interfaith Committee chairperson. Thank you for attending today, and thank you for all for taking the time to be here with us this afternoon. Okay, so a little bit about who we are in case this may be your first time joining us today. ADAPT is a coalition, a substance abuse prevention coalition dedicated to improving the overall health of all residents in Essex County. One of our committees is the Interfaith Committee, and they endeavor to empower the faith-based leaders of Essex County to understand and engage in issues affecting overall wellness in their communities. Our chairperson is Gwinnera Curry, our vice chair is Michael Doherty, and our secretary is Demetricia Barnes. They put together this annual symposium, and we also put together quarterly interfaith trainings. So just a little bit of housekeeping for today. Participant audio and video are turned off during the presentation. However, feel free to use the Q&A box to ask any questions that you may have, and we will answer them as soon as we are able to. The webinars are being recorded and available on our YouTube channel at Essex ADAPT. At the conclusion of this webinar, an evaluation survey will pop up. You can complete it, just takes a few minutes to do so we can improve upon our future sessions. We will be having a raffle at the end of our 4-day symposium. You will receive 2 entries for each webinar that you attend and 5 entries for attending our resource fair on October 29th. The drawings for these raffles will be held on the last day of our symposium, October 29th. Be sure to follow, like, share, and subscribe us. We are on Facebook, Instagram, Twitter, and on our YouTube page. If you can just post, if you want to take some pictures about your virtual symposium experience, we'd love to hear from you. You can just take a picture of your virtual setup or of your screen, or you can even add any quotes or any interesting facts that you've learned about during our symposium, and make sure to add the hashtag 2020 Interfaith Symposium and tag us at Essex ADAPT. Thank you. Okay, and just a little information about today. Today is Purple Thursday. It's a day where we recognize, we wear something purple to stand in solidarity to stop the silence and the domestic violence. October is National Domestic Violence Awareness Month, and so we just wanted to take some time to recognize that and to share awareness about this important event. So without further ado, I'm going to present to you our presenter, Joel Torres. He is the manager of our ADAPT Coalition. And just a little bit about him. I'm not going to go into too much. He is a certified health education specialist with over 8 years of experience in community organizing, outreach, advocacy, and grassroots campaigns. He's worked with municipal health departments and nonprofit organizations to bring programs and services to underserved, low-income members of the community. Currently, Joel serves as the elected representative of the Hudson County Board of Chosen Freeholders, representing parts of Jersey City. So without further ado, I want to present to you Joel Torres. Oops, sorry.
Good afternoon, everyone, and thank you for joining us. I will start by sharing my screen. Of course, thank you very much for being here with us today. We truly appreciate it. As Jessica so eloquently stated, Joel Torres, the manager of Family Connections ADAPT Coalition. And for those who have been around with us since our inception of the Essex County Interfaith Steering Committee, you will know that we are making history here today. So this is the first time that an ADAPT staff member is actually doing one of the presentations. We try to keep ourselves out of it. I think, except for the original one, where of course it's the original one, so we have to speak a little bit, but we try to keep ourselves out of it and try to highlight a lot of our partners and a lot of the great community members who are doing work here. But we think with the current pandemic and everything else that's going on, it's important for us to at least highlight a couple of things and have further discussions on it. So before I actually begin and get into the official presentation, I actually just did something on the fly right now. So you saw that Jess was talking about sharing your virtual setup and what you're doing. So, if you want to make sure you go on social media and just highlight your setup. So if you look here, you'll see my current setup that I have. I've got 3 screens here just to make sure that we have things running smoothly and that you can see what I'm seeing, and nothing is no technical issues are happening while I'm presenting, because I'm usually the tech guy. So it's important to be able to see what you're seeing and make sure that there's no issues going on. So this is my virtual setup. We hope that you highlight your virtual setup and share that on Instagram and social media, and use the hashtag that Jessica shared with you earlier. If I'm not mistaken, it's 2020 Interfaith Symposium. Just make sure to highlight that in your social media posts. Before we begin, just want to make sure that we give you a clear outline of what we'll be discussing today. We had a very good and productive morning presentation where you heard from Kelly Sachter from Family Connections, and she spoke about adverse childhood experiences, and she also highlighted protective factors related to ACEs, and also discussed a little bit of risk factors. So we're trying to utilize right now this opportunity to give you more in-depth details of what that consists of. What are risk factors? What are protective factors? And how can you support your community and highlight those efforts within, or highlight efforts to reduce risk factors and to improve protective factors in your areas, in your faith communities, or wherever you are currently serving. And we'll end, of course, with, or not of course, but we'll end with a little metaphor, a little story that I hope will tie everything together that we'll be discussing today. So a little bit about me for those who have not worked with us or worked with me in the past. I'm the manager of ADAPT. I thankfully have been here for 8 years, going on 9 years next March, serving as the manager of ADAPT. And being very involved in the work of Family Connections and all of our partners here in Essex County. I have a bachelor's in public health with a minor in Latin American and Latino studies, and I have a master's in public and organizational relations. I'm also a master certified health education specialist, so I have a certification in health education, which helps me in the work that we do here at ADAPT. If you have not worked with ADAPT in the past, we like to just give you a little bit of background on what we do, who we are. So we are a coalition, which is, in the simplest terms, a group of volunteers working together to improve not just underage drinking and substance use disorder, but improve the overall health and wellness of residents here in Essex County. We focus primarily on prevention, but we know already that people are using, and we're trying to do our best to reduce use and reduce access. We're in the empowering business, so we play very nice in the sandbox. We like to give resources and support to empower people, not just our adult members, but also our youth members, to grow and to collaborate more in the community and have better outcomes for everyone involved. As we've dealt with the pandemic, you've seen that we've had deeper conversations about other topics, not just related to substance use, but anything related to the social injustice and the social unrest that's happening, all the way to systemic thinking and looking overall and overarching at the systems that impact health and wellness at the local level. And hopefully with this conversation, we'll have a deeper understanding of systemic challenges and systemic ways that we can systemically collaborate and build into the future. Our overall goal is always collaboration. So we want to collaborate with people. We want to work together as a team in order to get to the goals of preventing and reducing underage drinking and substance use disorder here in the county. If you've worked with us in the past, you know that we focus on underage drinking, prescription medication misuse and abuse, and youth tobacco use and vaping. but we also dabble into other drugs and other conversations. Of course, we know marijuana use is a big challenge. We've been working closely with the LGBTQ plus community here in the county, and we realize that crystal meth is now a big drug that we also have to tackle as well. Our coalition structure, I went by most of this already. So a group of volunteers working together in different committees. Our overarching goal is to change policies and programs, but we know we just can't get there overnight. We have to make sure that we also provide information, educate individuals, raise awareness, improve skills, and build skills in individuals in order to get to the long-term goal, overarching goal of decreasing substance use disorder and youth access to drugs and alcohol here in the county. We are managed by Family Connections, and we're funded through various grants, including grants from the Division of Mental Health and Addiction Services at the state level, all the way up to the White House's Office of National Drug Control Policy over at the federal level. If you've not been involved with Family Connections, as you heard earlier in the day from Kelly, Family Connections has been around since 1879, and that's not a typo. Yes, 1879. So a very long time with a proven track record to help communities thrive and also looking to build a stronger, safer, and healthier New Jersey. I broke down most of this already, but I'll go to the last point at the bottom. Our overarching goal, as I stated, we start with providing information so we know giving you a brochure or a pamphlet is not going to help you change behavior or change your culture. However, we have to start with something. So giving you some type of information is always good as we get through the entire steps of changing consequences all the way down to modifying and changing programs and policies. That's what our overarching goals are, and that's the strategies that we use. If you've been involved with us in the past, you know that we focus on various committees. We have an underage drinking committee focused on initiatives to prevent underage drinking. Prescription drugs committee, same thing, but focus on prescription drugs. The Interfaith committee, which is hosting this lovely symposium this month virtually due to the current pandemic, focusing on our interfaith communities and building that prevention infrastructure within our interfaith or faith-based communities here in Essex County. And our newest one, our LGBTQ plus committee, which is focused on bringing in more substance use prevention programming and resources, focusing on the LGBTQ plus community. We follow what's called the Strategic Prevention Framework Model. In the simplest terms, it's a flower that you see there on your screen. We start with assessing. So we don't know what the problem is, so we need to find out what the problem is. Let's collect some data. Let's have some deeper conversations with the community, and let's find out what's really going on. Moving towards building capacity, making sure that we have enough people around and the right people around to be able to tackle whatever health problem we're working on, to planning and developing a comprehensive strategic plan, to implementing our programs, policies, and practices, and then evaluating to make sure that we're doing a good job. And throughout the entire process, we have to make sure that we are culturally competent to the community we're serving and that we are building sustainability to make sure that we can last a long time and have long-term results. So that's the overarching who we are, what we're here for. And now we'll get down to the nitty gritty and have deeper conversations into the risk and protective factors. But first and foremost, I want to have a dialogue with you. So I do want you to type in those in the chat box and respond to these questions to see where your current level of knowledge is at, and then we can move on with the presentation. So if you look to your right on the screen, it showcased the public health model, something that we are taught Public Health 101 when you go to college and get your degree. Of course, like I said before, assess. So you're defining the problem, then you're identifying risk and protective factors, and then you're developing and testing prevention strategies, and then you're making sure that it's used throughout the community. So risk and protective factors are a very important key to any type of prevention model, any type of model to reduce the negative health outcomes that are affecting our communities. So with that, I'm going to ask a couple of questions and then see from there what your current knowledge is. So my first question that I'd like you to respond in the chat box is, what is a determinant of health? And if the answer is I don't know, that's perfectly fine. That's what this presentation is for, but we want to see what your current knowledge is. So feel free to type in the chat box a response to what is a determinant of health. And I know we are virtual right now, so you might have access to Google on your phone or on your computer. Do not do that. Just give us whatever answer you have. You see any responses in the chat box? I'm trying to see.
Yes, there's race, economic class.
Okay. Somebody's done their homework. Good.
Not
Yeah,
sure.
I'm not sure.
Perfect.
Okay.
All right, let's move on to the next one. How would you define a risk factor?
And someone answered environment too for the
Okay.
previous one.
Okay, that's good.
I'm typing in the question in the chat box, and that makes it a little easier. Can you please read it out? Can you read it out? Too hard to read. Okay. So the next question is, how would you define a risk factor?
So the word, the term or the phrase risk factor, how would you define that?
People are saying they can't read the boxes.
Oh no, don't worry about the boxes on the side. It's more of the.
I did add it in the chat box, the question.
Yes.
So maybe you can repeat it again.
So how would you define a risk factor?
So what do you think a risk factor is? Or you want the definition or examples, Joel?
Examples could be fine.
Okay.
Anything
So, yeah.
yielding a negative or undesired results. Ah, good, Demetricia, perfect. Something that will prevent good health, family history, environment, something that leads to unhealthy consumptions. Perfect, perfect. All right,
Smoking.
how about protective factors? What's a protective factor? So if you want to cheat, you heard some folks saying that a risk factor can lead to a negative health outcome. How about a risk factor? I'm sorry, how about a protective factor? Positive attitude, information, yes. Protective factors can be supports or resources that place individual on the right track. Yes. All right, finally, how long does it take to reduce a risk factor or increase a protective factor?
We had some other answers for the protective factors.
Protective factors, social supports, good sense of self can often mitigate the risk. Yes. Positive countering events. Yes. All right. Deacon Dixon says 30 days is the average.
There was second response, 30 days.
It's the same, Deacon Dixon.
Oh,
Can be
sorry.
very fast. Joyce says can be very fast. Up 26.
Very exact.
The last one was actually a trick question. There's no actually average time on how long it could take. It could take as quick or as long as it can take, depending on the risk or protective factor that you're working on. So that one was a little trick question there that I was throwing out there, just to see if you guys were awake. And all right, so let's go back to the presentation. Okay, so just real quick before we get into the full presentation, I want to let you know that as we progress through our conversations, we know that the current pandemic is still a fluid situation. So we don't know everything and we don't have all the information. And the information changes on a constant basis due to whatever new knowledge we have due to the pandemic. So just be aware of that. The ideas or recommendations that we're making right now in this presentation are based on our current knowledge to date, and that can change moving forward. So just be aware of that. Risk and protective factors will progress through the fall and through the winter as we move through the next stages of this pandemic. As you see these pictures of beautiful young children, I want you to use this as a way to set a foundation as we move forward in this presentation. As we go through the different points, think of a hypothetical young child whose journey you're going to follow during our conversation about risk and protective factors. As we go through the presentation, think about the impact in their life based on the points that we're discussing. And feel free to write down some notes on how the discussion might connect to the child. And we'll talk about that. We'll share it during certain points in the presentation. But I just want you to keep that hypothetical child. It doesn't have to be any child that you know, any grandchild that you know, anything like that, but just a hypothetical child that you're thinking of that can be affected by the conversations we're having. The discussion we're having is important because a lot of the times when we work together or when we're working in our communities, we're so drowned in our work. We have so many reports that we have to deal with. We have so many deliverables that we have to deal with, site visits and conversations and quarterly meetings, that we get bogged down on not being able to solve the bigger long-term issues, but looking at just the visible problems because they're right there in front of us. And we know for a fact we have to tackle those problems because they're affecting our community. You know, those visible problems could be something like drug use, which is what we work on, teen pregnancy, child abuse, hunger, poverty, etc. But sometimes it's hard for us to look at the root causes to try to figure out that the long-term conditions, the historical generational issues that have been impacting our communities, the adverse childhood experiences that Kelly spoke about earlier, things like that. But it's important to have these discussions on root causes or risk and protective factors because it helps us understand the root causes, which then will help us tackle the main problem and then tackle the consequences that come out, which are either the actions that we see or that problem that is right, that visible problem that is in front of us. So it's important to have these discussions to find out what risk and protective factors are and how to identify them so that we can actually get to the root cause of what's affecting our communities. I asked you one question about the determinants of health. And as you know, we all work in different fields and we all hear different language and different terminology. But even though we do that, the terminology, the language always meshes and always fits. So I might have said the strategic prevention framework earlier. I might have spoken about the public health model, but within your sphere of influence, within the field that you work in, that might have clicked in a different way. You might know that by a different terminology, a different name. So I wanted to talk real quick about the determinants of health because they have a link to risk and protective factors. And it's important to understand what they are in order to move forward into the discussion on risk and protective factors. So determinants of health are factors in a person's life that potentially influence their health. There are 5 determinants of health, which can be your genes or your biology, your health behaviors, the medical care that you can get in your community, social characteristics that impact the community around you, and the physical environment that you're in. And all of these can either create assistance or they can create barriers to your well-being or your health and to a child's well-being and health. When we look at that context, we're also looking at the social determinants of health, and that's a bigger, wider aspect around the individual that impact their health and their well-being. That can be the economic stability around them, the neighborhood, the education, food, etc. When we discuss this, we're looking at the Center for Disease Control and Prevention, the CDC, has within their Healthy People 2030 model the 5 social determinants of health, which are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and the social and community context. And as we have a deeper conversation about these, we'll see that there are risk and protective factors at each level, which can impede or improve chances of overall health and wellness in an individual. And when we look at why is it important to have this discussion, why should we focus on social determinants of health or this conversation on risk and protective factors? If you look at this chart right here, roughly about 25% of things that determine the health of an individual or of a population, roughly about 25%, a little bit less, has to do with the person, has to do with their genes and their biology, or with their behaviors. The majority of what impacts the health of an individual or of a community has to do with external factors, like the social determinants of health. So that's why it's important to understand that, and important to understand the risk and protective factors in this full conversation. Because if we don't understand that, we can't focus on targeting them, and then we can't get to long-term change of health and wellness in our communities. So just to break it down for you and give you an example, these are some examples of social determinants of health. So when it comes to economic stability, we're talking about poverty, we're talking about employment, food security, housing stability, and a lot of these things are being impacted by the current situation that we're in, right? When we look at education, we're looking at high school graduation, enrollment in higher ed, language and literacy, early childhood education and development. We're discussing health and healthcare. It's about access to this, not just to healthcare, but to primary care and health literacy. And we know that in some cases, our minority communities might be the most impacted by this because they're either don't have access to healthcare, or they do not request any type of primary care or the overall health and wellness or the overall healthcare that they need to improve their opportunities to get a positive health outcome. We look at the neighborhood and the built environment. Some examples include access to healthy foods, quality of housing, crime and violence, and the environmental conditions around. As we move forward in the conversation, we're going to say environment a lot, but we're not talking about climate change or things of that nature. In this context, we are. Environmental conditions can be pollution around the individual, but as we dig deeper into our conversations, I'm going to use the word environment a lot. I just don't want you to confuse that and think that I'm talking about climate change or pollution or things of that nature. In those contexts, when I'm talking about the environment, I'm talking about the overall population or overall community. Finally, when we talk about social and community context, we're looking at social cohesion, how cohesive and how collaborative is the community around the individual. Civic participation, which is very important right now, as we all know, with elections coming up in just a few short weeks. Perceptions of discrimination and equity, which is another challenging situation that's at the forefront in our nation. Not that it has not been in the past, but with the pandemic and with so many people not being out and not having access to sports and things of that nature, our distractions have been taken away, and we've been able to focus more on discrimination and the lack of equity in our society. And of course, incarceration and institutionalization is part of that as well. So I'm giving you the full context of the social determinants of health to make sure that we can understand the interconnection of these determinants along with the risk and protective factors. As we move towards understanding risk and protective factors more and how they impact our local community, I want you to at least jot down 1 or 2 risk and protective factors that can be linked to each of the 5 social determinants of health. And this is not something you have to share with me. I just want you to learn as you move on this conversation. I want to make sure you leave this presentation with some tangible knowledge. I'm hoping that you can learn a few things from this and take this into the work that you're doing. Risk and protective factors within each of these areas can have a negative or a positive impact on the overall health and wellness of the child that you have within your hypothetical view right now. So just be aware of that. As I've mentioned before, in order to solve complex problems, we need to make sure that we can identify the risk and protective factors, and also understand that we can't do it all. Sometimes we're forced to do things alone, but one person, one organization cannot tackle things by themselves. Partnerships in the community are very important, and partnerships with members of the community are very important to give us an opportunity to connect the dots and to solve the overarching long-term issues that are impacting people around us. Now moving towards risk and protective factors. The research in the field of substance use prevention, which is the work that we work on, has helped us create a list of risk and protective factors that impact the prevalence of substance use. So I have a deeper understanding of risk and protective factors and the social determinants of health because of my background in public health. But some of the examples that I'll use throughout this presentation will be more towards the substance use prevention realm because that's what we do here at ADAPT. Risk and protective factors provide clarity to professionals to help you coordinate efforts that can improve the overall health and wellness of youth in your community. So we might work in substance use prevention, but we'll work with our partners at the community food bank to make sure we look at food stability and food security and things of that nature. Because we're looking at the holistic approach to health, not just the one track minded way of focusing on just one issue. And that'll lead to long-term solutions rather than just, like I said, looking at the siloed approach to trying to improve things. So as was very eloquently stated already by Demetricia and others before when I asked the original question, yes, the risk factors are characteristics at the biological, psychological, family, community, or cultural level that are associated with a higher likelihood of negative outcomes. That is the definition, but I like to simplify things to help you be able to communicate with your community and give some better understanding. So a risk factor, basically in the simplest terms, creates barriers to an individual's well-being or their good health. That's the simplest way that you can define it to somebody who you just talked to in the community. Protective factors, on the other hand, are characteristics associated with a lower likelihood of negative outcomes or that reduce the risk factor's impact on an individual or the community. It could be seen as a positive countering event. So once again, simplifying that, protective factors assist an individual in reaching good overall health and well-being. That's the simplest way that you can explain it to somebody. The image to the left kind of has some examples of that, from neighborhood safety to academic achievement to connectedness with parents, and we'll get into a deeper conversation. And just in case somebody's asking in the chat or somebody's thinking about it, yes, you will have a copy of this presentation. I'll make sure that Jessica sends it over to everyone who's attended so that you can have this and go back to it, hopefully to continue to learn and continue to grow. Now, when we're looking at improving, reducing risk factors, increasing protective factors, looking at improving the overall health and wellness of an individual, we need to understand that we're focusing on improvements at two different levels. And this is where that previous conversation about the word environment comes in. The micro level, is that individual level. So we saw that chart, and we know that 25% or a little bit less than 25% of what impacts the health of an individual or a community is at the individual level. So we still have to focus on the individual. We can't just ignore that piece. We have to focus on the micro level to make sure that we can help individuals develop healthy lives that are free of negative health outcomes. But we also have to make a bigger impact at the environmental or the macro level, which is looking at affecting change and modifying those risk factors at the overall community level that around the youth. be it at their school level, family level, community level, through policies, through programs, etc. At the micro level, at that individual level, the goal is to increase the protective factors and reduce the risk factors around a child, an individual child, or a set of individual children. So when you think of this, you're looking at the 5 core needs that we should be providing to each young individual to make sure that they can grow into a healthy and well-functioning adult. And I'm linking each of these to the social determinants of health that we spoke about earlier. The first core need is competence, and that's linked to education, which we spoke about before. The next is purpose, which will be linked to the social and community context. Belonging would link to neighborhoods and their built environments. The identity would link to the social and community context. And then security links to economic stability and to health and healthcare. And I'll break it down even a little bit more by giving you examples of what risk and protective factors look like at each of these levels. So when it comes to competence, you're looking at a risk factor, for example, of negative comments to an individual, telling them that you're dumb, you're stupid, you're worthless, etc. Looking at a protective factor would be providing tutoring or other opportunities like that. When we talk about purpose, it's a risk factor would be high unemployment among youth, which is a challenge right now with the pandemic, especially for young individuals, teenagers who they might have to work to be able to provide for their family. A protective factor might be a mentor who affirms her purpose or talents. A sense of belonging, a risk factor could be bullying at school, but a positive factor could be attendance at a faith-based youth group where they're accepted for who they are. For identity, you have a risk factor of poor family identity or a sense of ethnic identity. For a protective factor, you're looking at creating a connection with ethnic culture or family origin. And we know that a lot of our faith-based communities have a lot of cultural events, and this is a good way to increase protective factors as it relates to the identity. When we talk about security, a risk factor can be unsupervised or a youth being unsupervised in a violent neighborhood, and a protective factor can be providing a safe or supervised space for after-school programming, which once again, I know a lot of our faith-based communities offer. It's also important to understand when we're looking at that, at increasing the protective factors, there's different levels of the work that we have to do, the intervention work that we have to do at that micro level. One level would be that universal approach, where it's a broad approach, it's a broad stroke of the paintbrush, that you're trying to reach an entire population, an entire group, with just a program that's not specific to any targeted audience. Then you have the selective level, which you're targeting a specific group based on them being either high risk or based on the risk factors associated with their biology, with their psychology, or with the social environment around them. And finally, there's indicated, where it's a very focused approach where you're focusing on individuals who are either high risk or who already have started a negative health behavior or are dealing with a negative health outcome already. So just be aware that you're targeting approaches at every level. These are some examples just so that you're aware of when it comes to the work that we do at ADAPT and others. These are substance use related examples for each. So at a universal approach, it's those DARE programs or LEAD programs within the schools where you're doing substance use prevention, or it's the health classes where the teachers are talking about drugs and alcohol within their classes. It's not specific to one group, it's to the entire audience. Also, public service announcements, where you're making announcements in the community, or we usually do announcements during certain times of months. And then there's the awareness campaigns like Alcohol Awareness Month or Red Ribbon Week. Then there's the selective model, where you're looking for skills training for groups affected by the environmental influences around them, like high crime, unemployment, community disorganization. And finally, there's the indicator version where you're targeting programming for youth who are already engaged in substance use or negative behavior, and you're trying to alter that behavior or teach them coping skills or resiliency skills to improve their outcomes. Now, when we talk about the macro level, the environmental level, just want to reinforce once again that the problems are not found, most of the problems are not found within the individual, but the environment around them. So the goal at the macro level is looking to modify things such as policy and enforcement, increasing community services, increasing access and availability of programs, and improving community norms. Some examples of risk factors at these environmental levels. Before we get there, though, you need to understand that because youth have relationships within their communities and larger society, there's different risk factors at different levels. So there's risk factors at the relationship level, where one risk factor could simply be just a parent who suffers from mental illness or uses drugs and alcohol, or a partner who they are currently, it might be a high school student, they have a boyfriend or girlfriend, and they're in an abusive relationship. That can be a risk factor. Protective factors can be parents who are fully involved in the life of their children, a social circle around them that promotes positive influences. At the community level, a risk factor can be violence in the community, crime in the community, neighborhood poverty, and a protective factor can be the availability of faith-based resources or after-school activities, specifically for the youth. At the society level, risk factors can be racism, lack of opportunity, economic opportunity or mobility, and norms and laws that are favorable towards substance use. And then protective factors are laws against hate crime, economic advancement, especially for our youth and low-income residents, and then policies that are limiting the availability of alcohol within their community. So I want to show this video real quick just to kind of emphasize what I've spoken about already and give you some context from an individual who has dealt with substance use disorder in her life and with her family. So it's just kind of an overview of what we've spoken about already. So just give me, Gwenara, if you could give me a thumbs up, just let me know if you can hear it. Perfect.
So one of the questions that I get asked pretty regularly, or especially when I was younger, was how did you turn out okay? You had sort of a difficult upbringing, child impacted by substance use disorders. When I get asked this question, very simply the answer is it's science. Right? This is not a miracle, it is not magic. It was science and counterbalancing all of the risk factors that I came into life with protective factors. So if you it's science. Right? This is not a miracle, it is not magic. It was science and counterbalancing all of the risk factors that I came into life with protective factors. So if you think of it as a seesaw, I had a lot of risk factors on this side of it coming into this world, and for about the first 10 years. But then there were things that happened, interventions, and people that cared about me that counterbalanced that seesaw to put protective factors on the other side. So it not only leveled out, but it went in the opposite direction. And I think it's really important for us to remember that no child is unsavable, right? Regardless of the risks and the home life and the difficulties that our children are faced with because of addiction, because of substance use disorder, that we have the science and the tools to intervene and help to improve their outcomes. When we talk about why some people develop a substance use disorder and some people don't, I talk about the triangle, sort of the three main factors. And at the tip of the spear is genetics. We have about 50% of the individuals today that have a substance use disorder have a genetic predisposition, right? We pass this down to our loved ones, and you can't control that. But what you can do is know that you have a genetic load, that you have risk factors because of your genetic predisposition, like I do. So because of that, and knowing that I have 4 generations of addiction before me, I know that I have higher genetic risks than, let's say, my next door neighbor or my best friend. So I make choices that counterbalance that. So that's on that genetic side. And then on the other side of the triangle, you have environmental factors. It's about the community that you come from, the environment that you live in, things like poverty level, crime level, availability of substances in that community. And we know that there are interventions that can impact that, the norms that we create in communities. And then you have the individual side, right? That's things that are unique to me and unique to my family and my household. Parental monitoring, really clear expectations that are set forward, positive adult relationships, all these protective factors on the individual side that also have correlating risk factors. But how we address those, particularly for all the kids that are impacted by substance use disorder, is critically important. So I come back to that teeter-totter. I came in to this world with probably every risk factor that you can account for, both on the genetic side, the tip of the spear, the environment I lived in, and my individual factors. But I rebalanced that by the interventions, things like delaying the onset. I did not drink till I turned 21, and even till today at 41, I am very careful about alcohol consumption, intermittency, and being careful about my own use. Clear relationships. I had not only my grandparents and aunts and uncles that engaged as caring adults in my life, but was given a mentor through our county behavioral health services when I was just a kid that helped with another caring adult. Mental health care. I was court mandated to see a psychologist when I was 8 and continued that care to make sure that I had the mental health treatment that was necessary to deal with the trauma, the adverse childhood events, and those risk factors that needed to be addressed. We even know how to prevent this illness for those that have the most risk factors for developing this disease. And we just need to make sure that we're deploying them to every community.
Sorry, trying to find the unmute button there. Now you can, if you would like, in the comments, you can just put anything that one thing that you found interesting with that video. I'm going to keep moving along, and then either I or Alex, Jessica, or Guarnero to look back at the comments and to stop me if there's anything that we would like to discuss. But I want to make sure that I can move on in our discussion. As we look towards our faith-based communities and the impact that they have on risk and protective factors, we know that leaders and members of our Essex County faith-based communities already are doing things, and they can continue to reduce risk factors and increase protective factors in a myriad of ways. There are several simple examples. One is hosting programming, and I know that a lot of our partners are doing that. I know Deacon Dixon, who replied to one of our questions earlier, he is doing a lot of amazing things over at New Hope Baptist Church over in Newark. But hosting programs that train families on life skills, like the Strengthening Families program, which is a program run by Family Connections. So if you'd like more information, you can touch base with us about that. Encouraging positive emotional development, and also increasing volunteer opportunities for members of your community to help enhance their life skills as well, and enhance the soft skills that they might be able to utilize moving forward. Other real world examples that we can look at that most of you are doing already, or if not, these are some examples that you can look towards to enhance protective factors in your youth and families. Having children and youth programming, providing some type of daycare or after school care opportunities, religious education, pastoral care and counseling for individuals, social services, life groups, family programs, and community and volunteer programs like food pantries, financial assistance and training, clothes distribution. These are things that a lot of you, or most of you, or all of you are already doing. So you are already doing some things to enhance the protective factors around the members of your community. We applaud you for that, and we're always looking to be here to support you and partner with you to enhance evidence-based prevention practices that can occur within your places. So that can either be by providing information, by enhancing the skills of those around you, by providing support, enhancing access to services and programming, and reducing barriers. So enhancing those protective factors and reducing those risk factors, changing the consequences by providing incentives or disincentives for certain behaviors, changing the physical designs around your establishments or your places of worship, and modifying policies and programs. And if you did not know, your partners here at ADAPT can work with you to develop your faith-based community prevention toolkit. And that can be in various ways that we've done with some partners already, and that we are always open to do more in Essex County. One can be by assisting our Essex County faith-based communities in conducting a readiness assessment or a congregational inventory within their community to see what the readiness is to tackle any of the current risks and protective factors that might be around in their local community. It can be assisting our faith leaders in performing surveys, key informant interviews, or focus groups to assess the needs of the community and to find out those local risk and protective factors. Because we might know some of them, but we might not know all of them. So a deeper assessment is something that might be needed in your local community. We can help assess which prevention strategies will work within your community to improve whatever targeted or whatever assessed risk and protective factors there are. And we can continue to do what we're doing now, which is providing prevention messaging to faith leaders that can be shared with their communities. But these can be specifically related to targeted risk and protective factors. Now, as we know, we're all dealing with the pandemic and the challenges of what we're currently going through, which is why we made sure that the symposium was titled as such. So we're all coping with major changes to our everyday life, which might have us forced into some type of confinement within our homes, especially if we are ill or somebody around us is ill, to physical distancing from our friends and family. We're seeing the increased rates of poverty, unemployment, parental mental health problems, child abuse and neglect, substance use disorder, all around us. It might be impacting us ourselves as well. Our local residents and our local members of our faith-based communities or communities in general are not receiving the critical supports that they might need because services are limited or because they don't have access to the resources that they need to get these services. And there are also fewer adults who might have direct contact with their children if their children don't live with them. Now, some of these slides, I know I packed a lot of information into these, but you will have the slides later on to review them. So don't worry if it's too much. I'm not going to read it word for word or verbatim, but I wanted to make sure that I gave you all the information. So during this time with the pandemic, the goal is to increase the resiliency of our youth and to increase the protective factors around them. And I know that Kelly earlier spoke about resiliency. I just want to give some tips on how faith-based communities can help increase this resiliency during the current times and finding ways to expand protective factors and increase the opportunities to kind of make sure that our young individuals and even our adults can adapt positively, no pun intended, but adapting positively with the current adversities that we're dealing with. So first and foremost, one thing that we can do is promote sensitive and responsive caregiving. So that's through making sure that adults, parents, or caregivers know that they give them some strategies or some supplies that they can use to help be more sensitive or responsive to their children. Give them some tips or some resources so that they can have meaningful, age-appropriate conversations and family bonding times during the pandemic. Next is meeting the basic needs. So we can help families find resources. And that sometimes a lot of families go to our places, our faith-based communities in our local areas to ask these questions. Where can I get this? Where can I get that? So you are a source to help individuals find community services. And you can also conduct targeted outreach to folks who you know are marginalized or vulnerable within your community. We can also provide emotional support for children. This can be something done by facilitating access to remote services for families. If you or your faith-based community has access to computers, and you can help families who might not be able to have access to internet at their home, they can come to your facility and do their early intervention programming, have some mental health programs, or any type of tutoring or support at your facility. You can also provide support for the caregiver's well-being by giving them concrete informational resources on nutrition, on clothing, mental and physical health, etc. And also ensuring that the services are available through remote options if they have access to it. And finally, you could expand the social connectedness within members of your community by making sure that they have a way to connect virtually with others, either through cultural activities, through educational events, through some hobbies or support groups. One example that Gwenera, I'm going to give her a shout out. I know she's probably going to shut off her camera because she doesn't want it, but so Gwenera is working with ADAPT on a family paint night, which is something for next month, to have some type of social connectedness. So this is some ways that our places, our faith-based communities can help expand connectedness during these challenging times. And also making sure that you conduct regular check-ins with families or with children, either by phone or online, especially those who might have been experiencing some type of threat to their safety before the pandemic. It's important to just check in on them and make sure that they're doing well. So as we finish our conversation and as we finish the discussion on risk and protective factors, I wanted to leave you with a story. And this is not my story. This is a story from the Robert Woods Johnson Foundation. And it's a metaphor, a way that they communicate the social determinants of health to the broader community. And I think it's also a way to connect the conversation we're having on risk and protective factors today. So I'm going to read this quote here just to kind of help guide you in understanding this metaphor, which is called Health as a Journey. So each person must journey through childhood and adolescence to arrive at adulthood. This journey may look a bit different for each individual. Everyone is born into a specific family context consisting of particular cultural and physical backgrounds. The environment from which each individual comes from and the environments that they encounter will influence their health along their journey. The resources accumulated, the people they encounter, and with whom they associate will make up the individual person and influence their journey. Each young person is impacted by the choices they make, how they respond to the roadblocks they encounter, and their resiliency to overcome challenges along the way. When you think about that, and when you think about health as a journey, we need to understand that every individual does not start at the same path in that journey. There are some young individuals who start their journey with the resources available to them. And that can be the appropriate clothes or shoes to go on their journey, a GPS device to help guide them throughout their journey, a tent to sleep through, food, adequate food. Others pick up these resources along the way, and others expel a lot of energy to just try to get the necessary resources to get along their journey. Now, their health and their challenges along the way will be affected by the amount of resources they have at their disposal. We also have to think about the environmental influences. So each young individual is raised in a certain environment, and they're going to move around different environments. That can be safety within their homes. That can be violence in the streets around them, access to drugs and alcohol, or lack of access or limited access, a positive educational experience, nutritious food, quality healthcare services around them, or access to healthcare in general. The environments will also have an impact on their health. The social influences around them, the people that they connect with along their journey, can help them, or it can impede them and create roadblocks around their ways. So they can come in contact with a caring adult, a parent, or peers who can provide them proper navigation if they veer off of their journey. Or they can bump into friends who are already engaging in high-risk behaviors, and they'll lead them into a straight path. or add barriers along the way. So when you think about the individual, you also have to understand that each young individual's mental health, their physical health, any disabilities that they're dealing with, the traits that they carry with them, their resourcefulness, the attitudes that they have about life, that can also impact the journey that they have. And it'll limit the access that they have to resources and positive influences around the way. And then there's also the challenges. Every single person will experience roadblocks along the way, and those are just going to be there. And by whatever they learn from the other pieces, that will help guide them through those challenges and through those roadblocks to continue on their journey. So I like that metaphor because it helps you see a clear picture of health as a journey through life from a young individual until we continue to grow up. So now I ask you, and this is something once again that you can comment either by chatting, or if you want to raise your hand and just have a quick dialogue with us before we end this. Just let us know how your child, how that hypothetical child has fared along their journey. What can you do to identify and reduce the barriers in their journey? What can you do to assist them in their journey? And very importantly, what can we do to collectively improve the work that we do together, that collaboration piece, to support them on their journey? Those are some questions. Like I said, if you want to, if we have a volunteer, if you want to raise your hand and kind of comment on those questions, we are looking for that so that we can have an open dialogue and learn more from you. But also, I want you to remember that we don't always know what path our youth are on or the individuals are on. We don't always know the path that they're on. But if we can learn that path and we can work together as a team, we can assist them along the way, which is very important.
So if you would like to share your opinion, you can just send us a quick message on the Q&A or the chat box, and then we can give you the opportunity to unmute you.
I think also the raise hand function is also available just in case. If you go by your name, or I think at the bottom of your screen, there's a little feature that says raise hand. So hopefully you've learned something and you just want to share. I saw Deacon Dixon had his hand raised.
Yeah, I thought I gave him the opportunity to speak. Can you?
I can hear you. Can you hear me?
Yes. Yes.
Yeah, I first of all, Joel, great job. Wealth of information. I'm going to have to go back and look at the video you post to really get it all in. But I think that issue of supporting our youth in their journey is one that is so important, and it's one that I've been trying to pay close attention to probably for the last couple of years, and have had conversations with others about our responsibilities. When I say ours, I'm talking about the adults, the elders of our community, that we really need to check in with our youth in almost an intentional way. What I've found most times with our young people, they'll tell you what they want you to hear, or they'll tell you what they think you want to hear. But it's incumbent upon us to really explore. And what you've given me this afternoon are really some great techniques, questions, probers to really activate that conversation in a more meaningful way. Our youth deserve it, they need it, and it's really, we can't just wave them by. We just can't say, well, it's not my responsibility. So I thank you, and I pray that all would be able to pick up on some of the devices that you shared with us this afternoon. Thank you.
Thank you as always, our good friend Deacon Dixon. We appreciate that. I know I'm a little bit over time, so I'm gonna, if you have any questions, feel free to ask. We can always use your support here at Adapt. The slides will have our contact information, just once again, just to have it available to you. And as always, make sure to connect with us on social media. We're doing a lot more on YouTube and our social media platforms. You'll see a lot more YouTube videos up during the next few weeks, and we hope that you can be a part of that. But with that, I will mute myself, drink some water, and pass it on to Jess.
Thank you, Joel, for that in-depth presentation on risk and protective factors. Like Deacon Dixon said, a wealth of information, and you will be sent these slides to look at them over at your own leisure. At this time, I'd like to share my screen. Okay. Okay, and then I'm going to turn it over. To Gwenera Curry, who is going to lead us into our think tank discussion and perhaps a little stretch break.
All right, Jessica has gotten to know me a little bit more during the symposium and the virtual experience. Yes, I want to give everyone a minute to kind of do your stretch break, do your mindfulness, whatever it is. If you need to run some calisthenics real quick, do what it is. Just want to give you a moment to kind of unseat yourself and just refresh yourself and rejuvenate yourself as we are going to enter into the discussion component of all of the material and all of the learnings that Joel has presented to us today with the risk factors and protective factors. So hoping this will be engaging. So let's just take a moment, a pause. I'm gonna black out my screen so I can stretch a little bit as well. And we'll come back to you in a couple of about 30 to 40 seconds. And if you need to grab that bottle of water or whatever it is, this is the opportunity to do that. Okay, everyone, if you can kind of guide yourself back to the presentation, back to our time of discussion. Again, I want to thank Joel. I'm glad to be part of the pioneering of having an adept staff member actually lead a segment. So this is trailblazer that you are, Joel. This is just par for the course. We may look at more opportunities to do this. That was very informative. I felt like there was a lot of tangible knowledge and it really helped fill our toolbox. I'm going to take a little detour, Jessica. I'm going to go to question 2 instead of question 1 this time, because we're talking about youth and want to talk a little bit more about, from an organizational perspective, the information that was learned and gained today, how any of our participants can develop a goal that you would like to implement regarding the organization you represent today or your faith-based community when it comes to the protective factors and decreasing the risk factors for youth. We're talking particularly during COVID-19, but it may be for the long term. It may be something that you learned today that will equip you to do that. So we want to hear 1 or 2 goals. Please feel free to use the chat or the Q&A. Jessica and I will moderate that, but certainly want to hear from you. There are many more perspectives, many more experiences, and this is going to benefit all of us as a collective to understand what you are taking away and how you're going to implement what you've learned and gained today from this webinar. So I'm going to pause again for a couple of moments, hopefully that someone will jump into the chat box or the Q&A box so that we can get going. So I think we have a message already. Okay, we have from Deacon Frank Ingalls. Thank you, Deacon Ingalls, that it was a lot of information and very informative. Yes, indeed. Yes, indeed. Deacon Ingalls, would you be able to share any highlight or any particular information that you found that you could directly implement or influence you as you continue your work with your congregation? So just as a reminder, as you continue to consider what organizational goal would you like to implement? Oh, and Deacon Ingalls has been given permission. So I will pause and unmute yourself, Deacon Ingalls, or Jessica, whoever has to do it, so he can certainly offer his implementation strategies. Deacon Ingalls, if you're speaking, we can't hear you. You can unmute yourself.
Hello.
There you are. We hear you now. Go ahead. How are you?
Well, and and some of the information, especially when we're talking about the faith-based community on what we're doing. There's a lot of stuff that we are doing, like we do have it's on hold right now, but the food pantry, the feeding, the community, and also with my ministry dealing with addictions. You know, a lot of it is being done. It is at hold right now because the church is closed. Hopefully, we'll be back in full operations when the year turns. But there's a whole lot. There's a whole lot of other stuff that I like to, probably work on with Joel and the committee and stuff. You know, the coalition on doing. You know, especially doing some surveys within the community on how better we can assist them in doing. You know,
Thank you,
it's a
Deacon
lot.
Ingalls. Oh, I'm sorry. I thought you were. Sorry.
Now it's a lot, and it's just sometimes I just can't completely express it because you know.
Okay, thank you. I think you raised a couple of key points about food insecurity, which is significant. As Joel walked us through his presentation and the protective factors and the risk factors, we know that's significant, right? That's a base need for any of us. So what your congregation is poised to do, whether it's on hold or not, and all the efforts that you've contributed thus far, we appreciate that, and we believe it's making an impact. So thank you for sharing that. Because food insecurity is certainly during COVID-19 a lot of the challenges that many families have not faced prior to this. So, so thank you for highlighting that. Anyone else have a contribution?
You can check the little hand on your screen if you would like to speak. We can give you permission to speak, or type it in the chat box.
Yes, we might not be able to see all of your beautiful faces, but we would love to hear your voices. Okay, well, if we don't have any more questions about organizational,
Demetricia mentioned something. Demetricia comments, the church is currently in the process of training mental health coaches via Light University.
Yes, thank you. Thank you, Demetricia. That's going to go a long way to help individuals in managing the mental health aspect of, okay, no pun intended, but adapting through COVID, spirituality and wellness. I'm sorry, I just had to go there, folks. But yes, thank you, Demetricia, for that. Thank you for sharing that.
Gunera, can you explain a little bit more about the mental health coaches? It's who was being trained specifically?
So the invitation, as I understand it, went out to those who were already leaders in the congregation. So from my understand, it was equipping deacons, ministers, and pastoral team members to become more aware of trauma, the triggers, and how to, I'm going to use the word triage because we're talking about mental health, but also how to help individuals navigate those components as we continue to adapt again to what COVID is presenting to us as a congregation and as a greater community. Our church is a larger church, so our tentacles, if you will, spread beyond just Essex County, but certainly we're looking at opportunities to, again, equip lay people, if you will, with tools to help those that are responding to, addressing, or in certain situations having episodes with involving their mental health.
Okay, great to know. Maybe some other organizations or faith organizations can implement that.
Yes, I'm sure Light University would be excited about that because when I was exposed to it, I believe they were requesting of congregations and faith-based houses to have some of their leadership participate in this ongoing training. So the invitation may still be open. Maybe they didn't meet their threshold. I know it was a significant number when I was first introduced to it. So. But thank you, Demetricia, again, for referencing that.
Deacon Ingalls said, this is through the American Association of Christian Counselors.
They are affiliated with the program as well. Yes, they are. I don't know if he's asking or telling, but I'm affirming that the American Association of Christian Counselors is associated with the mental health training that's occurring at Light University.
Okay.
And it is virtual, if I can add that too. It is virtual, so it is not, you don't have to feel as though your congregants or your leadership would need to have an in-person experience. It is virtual.
Okay. Does anybody else have has thought about an organizational goal that they may want to implement or bring up to their faith-based or organizational agency that might be helpful as a result of this webinar? You can type it in the chat or you can ask to share it verbally. Okay. Okay. All right. So do we want to go to the question number 1? Okay.
I would like first to go to question number 1 to talk a bit personally now about how we would implement what we've learned today about the risk factors and protective factors when it comes to our youth and within our community or within our families or maybe within other families or structures that we interact with. I believe there's still more information and more implementation strategies or goals to be shared. So I want to hear from you. Again, just to reframe the question for you, if there's a goal that you can identify or share with us that you would like to implement as a result of this webinar. Okay, well, it is Thursday afternoon. Perhaps many of you are ready for that weekend eve or that Friday eve and are kind of coming down the slope, if you will. But we thank you for participating today, whether both sessions or this session. Hope this has helped equip you differently or more expanded your equipping as you continue to serve those or perform your duties. So we thank you again for participating. We thank Joel again, and I'm going to mute myself and turn it back over to Jessica.
Thank you, Gunera. Just a few closing remarks, some announcements about our ADAPT events tonight at 7. We are Julia Rivero and Giselle from the Partnership for Maternal and Child Health will be presenting a webinar for Spanish-speaking families and individuals on prescription drugs and some tips as parents and how to talk to your kids about that. That's tonight at 7. Next Tuesday at 10, October 20th, we have our Prescription Drugs Committee meeting. And next Friday, October 23rd at 5 p.m., we are having our Incorruptible Essex Youth Kickoff event. This is for Essex County youth, ages 13 to 18, who want to become more involved in our coalition in substance abuse prevention. We focus on tobacco and vaping, but we also will be addressing underage drinking and prescription drugs. So this is an opportunity for youth to become involved, earn community service hours, meet other like-minded peers, and even attend virtual and hopefully by next year in-person conferences, leadership conferences. So this is a great opportunity for youth to become involved in their community. All of our events are on our Facebook page at Essex Adapt. And our symposium days, we have 2 more days left. October 22nd is going to be focusing on impact on mental health. 10 a.m. we'll have the mental health consequences of COVID-19 and physical distancing. We'll have our crew from our WJBH Clara Mass Medical Center presenting. And at 2 p.m. we will have Phil McCabe from the Rutgers Center for Public Health Workforce Development talking about managing grief and loss. On October 29th, we'll be focusing on self-care and resources. At 10 a.m., we will have Kelly Satcher from Family Connections speaking on strategies for self-care and mindful meditation. And at 2 p.m., we will have our resource fair and our closing remarks ending our symposium, Interfaith Symposium 2020. And this is the opportunity to win raffles for restaurants in the local community. All right, so don't forget to subscribe to our YouTube channel at Essex Adapt. Also, please post about your virtual symposium experience. We want to hear from you. Take a picture of your virtual setup or even any quotes or any information that you learned today or any of your past days. You can send it to us at the hashtag 2020 Interfaith Symposium and tag us at Essex Adapt. We are on Facebook, Twitter, Instagram, and on YouTube. Okay, and upon the conclusion of this webinar, you will be sent a link to do a quick survey, an evaluation about our session today. If you can just complete that so we can improve on our future sessions. And this concludes today's presentation. We hope to see you next Thursday at 10 a.m. for our next session. We hope you have a great rest of the day and a great weekend. Thank you. Bye-bye.